I'm Andy Truscott. I'm the Global Health Technology Lead with Accenture.
Thank you, Andy. Accenture, a lot of people know the name in healthcare, but for those unaware, what does Accenture do in healthcare?
So we're one of the largest systems integrator, management consulting, strategy organizations in the world, and we work across multiple industries, of which healthcare is one of our principal ones.
Yes, and so here at HIMSS, and as we were chatting before, you've been to one or two before, so you know the drill here at these. It's like a second home, right?
Well, I've been here, as you said earlier, this is my 25th HIMSS that I've been to, and they've changed phenomenally over the years, okay? And just the sheer scale, but also the enthusiasm that's here. It's palpable. And as technology shifts and has happened over time, you find that directly manifests into what you see here at HIMSS. So last year we kind of had the advent of generative AI, and that was getting adopted. And this year you're seeing a lot of that now being put into action. And hey, there's a lot of vendors here. There's also a lot of organizations here wanting to learn. There's also a lot of organizations here wanting to understand each other as well as our customers.
Yeah. Hey, I'd love to hear from you, since you've been in the game for a bit and you've seen a lot of those trends and the hype cycles and the problems to solve in healthcare and a lot of consistent things that maybe have not changed from 25 years ago to now. Take me through that evolution, I guess, to where we've got to now, because it is, we talk about how it's an exciting time. There's the transformational impact of artificial intelligence, but still a lot of tricky problems to solve in healthcare. Walk me through how we've got to this point and what you see as like real kind of turning points that people should be thinking about now.
Okay, so actually every year inside Accenture, we do a look to the future. Okay. And we call it our technology trends report, and we put it out, and we've recently put out our one for this year. But we also do a health specific view on it, and comes as no surprise that we do actually think that this year is the year of generative AI, generalized AI, and general AI adoption, and it's the first year when actually all the trends have been focused around one thing. Normally, there's a diversity of trends that we see. But we first started talking about the human plus machine, some 8 years ago, when AI was coming to the fore. And, we then went into like the metaverse world, and then I don't know if you noticed, we had a pandemic.
I'm familiar with that.
And technology and the people who provide healthcare services got incredibly stressed, and in many places the breaking point. And what we're seeing now, I think, is the technologies which were very nascent during the pandemic coming to the fore around generative AI, the transformer technology. And we're seeing that become much more mainstream, because it enables us to create better solutions and deliver better care. And it does that by, we see four big trends this year. The first one is around what we call the binary big bang. The idea that actually every organization, you and I were chatting earlier, everybody here knows about AI. Okay? Everybody has the best product out there when it comes to AI. And some of that's right, some's not right. But the binary big bang's happened. Okay, and it's happening for care organizations as well, seeking to adopt that type of technology. And in the middle of that is this idea of the cognitive brain and the fact that silicon can actually support and help you think things through. But we're also very clear that AI doesn't bring about judgment. Humans bring about judgment. Humans discern and understand what information means. At the end of the day, generative AI models are very large, very complicated mathematical problems. Okay? And that still means that we have a very strong need, especially in healthcare, for that judgment from a human in the middle. That never goes away.
Yeah. It is interesting thinking about that discussion of, what impact will technology and artificial intelligence have on workforce? But increasingly, as I'm hearing conversations and perspectives with people, it's almost the other way around, is that we've got so much pressure on workforce that we're going to need to lean more into technology to help address some of these issues as well. Need the human element, but sometimes we don't have the humans there to be able to do all the things we need to do.
I think you're right. I cannot find... If I look around the world, and I'm very fortunate I get to look around the world at healthcare organizations, there is not a single one in the healthcare provider space that would say, we have enough people.
Yeah.
Everybody has a shortage,
Yeah.
And that shortage has been going on for a long time. We've had less and less people entering the healthcare professions. We've had less people entering nursing schools. We have less people entering medical college. And we've had more people leaving. So that problem has got worse and got exacerbated. The pandemic exacerbated it, but it's going to continue. And so because we have that shortage, we believe that the adoption of some of the technologies we've been talking about today and will continue to be developing over the next few months and years, they actually are able to fill some of these problems and address some of these gaps. Notably, whenever we're talking about healthcare, we talk about access, we talk about experience, and we talk about outcomes. So patient access to the right care and the right place in the right time. Their experience of care delivery and the physician and healthcare professionals' experience of care delivery, how do we make that as straightforward as possible? And then the outcomes. The fact that I am fitter, I am less sick because of the best care I've been provided. And AI can support the workforce across all of that. And enabling you to engage with patients wherever they are. You know, harvesting up some of the technology which we explored in the metaverse world, to use like hyper-real digital humans with conversational AI enabled underneath them, with a cognitive brain that's highly trained upon specific healthcare needs to enable a patient to navigate the healthcare system and then integrate using the standards, so HL7, SNOMED, etc. Using those to actually integrate with the existing systems that we have. You actually provide better patient access. So if you're living in the rural hinterland of Australia, for example, middle of the US, middle of Europe, for example, where it's not a 5-minute walk down the road to go see a physician, you can actually start engaging with healthcare and navigating yourself in a much more meaningful way. That is the opportunity we have in front of us right now. And that enables us to get patients getting better access to care, and it liberates some of our healthcare professionals to doing other roles as well. That labor arbitrage in the middle. It could be as simple as straightforward as patient education. Having a conversational avatar that's trained upon a particular procedure that is explaining what your procedure is going to be, that understands your clinical disposition and the morbidities that you have, and can actually help navigate you through all the questions you have. And where we've been looking at this, we also find that patients spend longer with a digital human than they do with a real person because they can. And because they're available 24/7, and you're available on my terms.
I guess you don't feel like then you're being a disposition, like I'm being a hindrance by spending more time with this individual. I don't know, Andy. Like I think about,
it's cool, right?
It is cool. However, like in Australia, in particular, rural and remote care, people can't access a clinic. We've got the telephone. We use the telephone, even though we wanted people to use virtual consultations. Still, phones were fine, and you can do a Medicare rebate for that. Patient education, there's patient education material, all that fine, but inherently if patients don't, like a lot of people go to the doctor because they need a medical certificate so they can get paid to go to work the next day, and inherently healthcare, if they're not sick, they're kind of fine. But you need like that health literacy or the people to genuinely value the importance of preventative care and all that for the whole system to work. I sometimes wonder and I worry that like with all of the, cool, now we're going to talk about artificial intelligence, let's work out how we can apply it to the healthcare system and then position it so that then, we can demonstrate its worth. Like where is that gap? Like we've got solutions for these things already. You see the big picture and you've been around long enough. Like what's that genuine kind of value that some of these cool technologies can deliver that we haven't otherwise been able to do before?
So I think we can sum it up in one word: trust. Okay, and again, it's something we're talking about right now as we were talking about AI in this year's report. Trust is the limiting factor for any of this, and it's also historically what's important. The most important thing in the middle of healthcare. You trust the people caring for you. You trust that they are appropriately trained and they're making the right judgment calls on how to provide you care. So the adoption of these types of technology, the limiting factor is trust. And it's trust from a patient, which we actually find is pretty easy to get. The trust that's hard is from healthcare professionals and from the regulated bodies to say, actually, this is right. We've been doing some work in the cataract space. Now, cataracts is one of the most frequent surgeries there is, okay? And in the US, I think this year we're predicting we'll do something like nearly 4 million of them. That's a lot of surgery.
It's a lot of surgeries.
But there's a set of clinical practice guidelines that you, as a healthcare professional, work through with your patients before they go and have the surgery. And it takes roughly, 60 minutes to have that conversation. Well, 4 million times 60 minutes, that's an awful lot of clinician time that's swapped up by that. Well, the clinical practice guideline is highly computable. Okay? You can train your cognitive brain on that. You can put all the guardrails and limitations you want to around that, so it's very, very strict. But you can then put conversational AI on the front. You can enable one of these digital humans to converse with a patient, and you can go and actually start providing direct patient care. And we're talking whole people here to return back into the caring professions. So yeah, if I'm doing 8 of these patient educations a day, it takes a lot of those days to get up to my 4 million treatments a year.
Yeah,
okay?
Interesting.
That's where we think the opportunity is, but only if you trust it. So as the ophthalmologist, you trust the model. You're going to work on it yourself. You can play with it yourself. You're going to understand what the advice is doing. You're going to understand that if the patient's got had UV exposure, that there's actually going to be a slightly different set of advice that's being given in there. Or a senior needs to care for a wound in a slightly different way than a younger person. And once you trust that, then you're going to embrace it. And in talking to healthcare professionals, there's always that healthy level of skepticism. I mean, it is a healthy level. But then once they start embracing, it's there. Now, HIMSS last year, my 24th HIMSS, we showcased this for the first time with cataract surgery. And there was this level of skepticism and surprise that this technology existed. This year, we have people coming to see my team here, and it's all about, well, actually, what can you do with this next? And they're bringing use cases to us and adopting this type of tech. We have a digital human creating appointments for you in your existing EMR. That's cool.
That is cool.
That's meaning we don't need to have a human sat there doing that.
Yeah. Amazing. Lastly, I think just keen to lean a little bit more into, Accenture at HIMSS, a lot happening. You've touched on a few good examples there of the types of conversations you're having with attendees, but is there any other announcements or sessions happening that you're plugged into that you're sharing with the audience here?
Right. Well, so you're trying to get me to give you a scoop on something?
If you want.
No,
or you get a cheap plug, either way.
That's willing to offer, man. What we are all about when we're here is talking to our clients and listening to our clients and listening to the broader market. And this is one of the values that we have with coming to HIMSS and why we will keep on coming to HIMSS, no matter as it metamorphoses over the years. This is the only place in the world where you will hear all of the voices at one time. And so you have to be really good at listening to them and understanding what's going on. And that's the biggest value that I get from HIMSS. Okay, it's great to meet people like you. It's great to sit here with a microphone, and that's cool, and it is cool. But no, it's about listening and understanding. This is what people want, and this is what their needs are. And very often, folks are not great at articulating those needs. They express those frustrations. They express the outcomes they want to get to, and it's up to myself and my colleagues to help navigate that, get out the hazel sticks, and divine what the future's going to be. And hey. We're still here. We're doing a great job of it. We have so many clients here now, and so many of our ecosystem partners as well, all the technology organizations we work with. It's a fantastic event.